And this evening I want to talk about this FDA warning, which is very bad news for people who are taking stimulants for ADHD. That people who take methylphenidate products used to treat attention deficit hyperactivity disorder. In a recent review, methylphenidate products, the FDA found that patients experienced priapism ranging ages from 8 to 33. And it's not just about dosage, it's also like the type of medication you are using, the interval between the doses. And we need to focus on this particular problem because there are so many people nowadays who are using these stimulants, and healthcare professionals, when switching the medications, should be careful because even atomoxetine, the Strattera, the non-stimulant medication, it's also linked with priapism. So priapism is the painful erections of the penis. So priapism, please keep that in mind when you're giving ADHD medications. When changing people from a methylphenidate to atomoxetine, the Strattera, and inform people that this medication can cause painful erections. And medication guidelines, give these medication guidelines to the people when you are giving this medication, when you are describing the side effects to male patients. Talk about this because some people, I have many patients, they feel embarrassed when to talk about their sexual problems, like even people with antidepressants, SSRIs, developing sexual problems. They feel embarrassed to talk about people. The same here, ADHD medications, people taking Ritalin, methylphenidate, talk to them about this important problem because it's very common. So you see, ADHD is the second most frequently diagnosed disease, just trailing asthma in children. Isn't it interesting? The second most frequent long-term diagnosis in children, narrowly trailing asthma. That's an important point. So this is coming a statistic from Centers for Disease Control. The second most frequent long-term diagnosis in children is ADHD. So there will be a lot of children who will be kept on this, and out of 1 million, out of 6 million people who are on ADHD medication, 1 million people are taking it illegally. So imagine the enormity of the problem here. 1 million people taking other people's drug, and there are 6 million people. And this is a big problem among college students. And I have some patients like college students. They ask about a stimulant. I got an exam tomorrow. I'm so worried. Give me a stimulant. A mother with a lot of kids, they ask for an anxiolytic. But a mother who has to work a lot, she would ask for a stimulant. So you see the reversal of the whole thing. Like in the olden days, like a woman used to have a lot of kids, and they ask for like the stress, and when their husbands go to work, they used to ask for, can you give me an anxiolytic like Valium? The it pill at those times was like an anxiolytic. Now women who are going to work while keeping their kids at the home, and they have to work hard like 2 or 3 jobs, they keep themselves stimulated, so they rely on stimulants. A lot of kids anxiolytic, lot of work stimulant, and no wonder Focalin, Methadate, and amphetamines like Adderall, Dexedrine, they are being used. Now let me give you some important points. These are basically sympathomimetic drugs. They inhibit presynaptic reuptake mechanisms, and they release presynaptic catecholamines, especially dopamine. So these are sympathomimetic drugs increasing intrasynaptic catecholamines, mainly dopamine, by inhibiting presynaptic reuptake mechanism, and they release presynaptic catecholamines. And methylphenidate especially blocks the dopamine transporter protein. And amphetamines, they release dopamine stores and cytoplasmic dopamine directly into synaptic clefts. So you see the difference. Methylphenidate specifically blocks dopamine transporter protein, whereas amphetamines, they release dopamine stores and cytoplasmic dopamine directly into synaptic clefts. So remember the difference, but overall remember they are sympathomimetic drugs. I mean, this sympathomimetic property has anything to do with priapism? I don't know. Nobody knows at this point. The mechanism is unclear. So these medications, once you give them, they reach peak effect in 1 to 2 hours after administration, and the effect lasts like 2 to 5 hours. And the amphetamine products like Adderall and methylphenidate and dextramphetamine are intermediate acting compounds with onset of action within 16 minutes and a duration 6 to 8 hours. Given the need to additionally treat ADHD outside of academic environment nowadays, like children are going, and many times they divert the medications. Think about extended release formulations to reduce those kind of diversions, and they are coming. And so the main point I wanted to tell you this afternoon was ADHD medications can cause painful erections called priapism. They can cause priapism, and please discuss this with your male patients and make them relaxed, and then talk about it. And hopefully this presentation helps you, especially to talk about this important